Well, what are the implications and societal impact of the lifting of the ban on alcohol and tobacco sales? Joining us now to talk about this is South African Medical Research Council Director for Alcohol, Tobacco and Other Drug Research Unit, Professor Charles Parry. Prof, good evening and thank you for your time tonight. So a good decision then by the collective to lift the ban on alcohol and keep the curfew in place. How will that help?
I think it's good and bad. I mean, I think we couldn't have kept the ban going for too much longer. I mean, it was put in place in order to relieve the pressure on hospitals because of trauma presentations were clogging the hospitals where we needed those beds for COVID-19 patients. The hospitals are not so crowded now, so that particular reason isn't there. But we haven't seen all the directives, but certainly I was surprised by a couple of things. One, as I said, the opening up of bars, taverns, nightclubs, casinos, and so on for drinking. I wasn't expecting the on-consumption sales to be open, perhaps only at restaurants with a meal, but not all the bars, because that's certainly been a big problem in Europe, and some of them have closed that down. Ireland, for example, has put that on hold now for another 3 weeks. I don't know. There might be some more directives coming. We're waiting for the regulations tomorrow. I certainly and colleagues have been recommending that if the ban was lifted, that it come with certain caveats. For example, limits on the amounts that people could purchase, to stop the sort of selling of bucky loads full of alcohol for resale by unlicensed outlets, requiring identification. And limits on marketing and so forth.
So those are some of the things that you suggested, and we'll get to them. I want to hear how much of them have actually been considered. But let's stay with this a little bit. As you mentioned, in the UK and I think in the United States as well, epidemiologist Fauci saying bars are a bad idea. In fact, they are reversing that idea of opening bars because they pose a potential risk. Loud talking, not wearing masks, practicing good hygiene. You can't afford to touch your face when you're drunk. Also, the indoors, though they're very close, you're in prolonged closed spaces, it spreads faster. And what could have been the reason why they decided to lift the ban on on-site consumption?
All I can think of was pressure from the liquor industry and the pressure for jobs that the industry is making quite clear that they're talking about 1 million jobs. I'm not sure it's that high. We haven't seen their figures. But certainly the economic pressures must have been enormous on the government. But I was very surprised because, we can't have a second spike. And opening bars is certainly a huge risk factor for community transmission, as you're talking about. If there's loud music, people shout, and that can also increase the risk of transmission. If people are standing at the bar waiting to buy alcohol, they're in close proximity with each other, and so on. So, yeah, I was very surprised by that. And all I can think of was the economic pressures that was put on the government to do that. But, yeah.
What would be your recommendations to tavern owners at this time? Because looks like they will be given that opportunity to open.
Yeah, I mean, certainly I think the one idea they had in Ireland, they said bars may only open indoors if they serve food. And that was actually Northern Ireland. In the Republic of Ireland, you had to spend €9, sort of over 100 rand. So, for a meal. And I certainly think we should probably be making the requirement that no alcohol sold without a meal. I think it's going to be a huge risk, and I don't think we should be taking that risk. We're going from a complete ban to suddenly opening up completely, and I think that's a huge risk for the country, and I'm surprised that they've done that. But maybe we'll hear more in the regulations that are coming out tomorrow. Maybe there'll be more limits. The only one we know about is no more than 50 people. But we also don't know how well these things will be policed. Will the 10 p.m. curfew be properly policed? Is anyone policing these establishments to make sure there's only 50 people in them? I don't think so.
The other question, Prof, of course, is the limiting the availability of alcohol by reducing the number of days. You had suggested moving them from 4 maybe to 3. It looks from the President's announcement that is not one of the recommendations they took, because they are keeping it at Monday to Thursday, 9 to 5.
Yeah, I don't feel that strongly about the 4 and 3 days. I think at least they've kept it no alcohol sold over the weekend for off consumption. I think that's a good rule. But certainly for on consumption, then it'll be 7 days a week until 10 p.m. and that certainly is a concern. We're still waiting to hear if there are any other restrictions. For example, us and the Southern African Alcohol Policy Alliance was saying that we should be not selling alcohol in the larger containers, the 1 liter and 750 ml beers, for example, and no larger than 750 ml for wine and spirits. So, the president didn't make any announcements regarding those sort of things, and we also recommended moving ahead with the decision to reduce the maximum blood alcohol concentration for drivers. I also think we need clear guidelines in terms of not allowing special offers and promotions at this time, and even taking away advertisements except at points of sale. We really don't want to be encouraging people to be drinking, and we need to have learned from the experience of, as you talked about, the USA and Europe in terms of really restricting the on-consumption selling of alcohol.
Have you considered the increase of the price of alcohol and what impact that would have on the businesses themselves? Because I see that's one of the suggestions that you put forward.
That's a more medium to long-term suggestion. Much of the alcohol sold in South Africa is, if you look at beer, for example, sold between 4 and 6 rand a standard unit if you're buying the larger containers, and that's a very cheap price. So one of the recommendations, and this is many other countries are doing this as well, is looking at minimum unit pricing. So you can't sell a standard unit of alcohol below, for example, 8 rand. So that's an area to look at. We also have an unequal system where wine and beer are sold below the tax price on spirits for the same amount of absolute alcohol, and that doesn't make sense. And the other issue is the taxation of alcohol in South Africa is substantially lower than it was in the 1970s, whereas the taxation on cigarettes has increased dramatically. So there are some issues around pricing that we need to have some discussions on. I'm not sure that's something that should be implemented right now. A lot of people have lost their jobs, but that's certainly something to talk about in the medium to long term.
As far as data is concerned, Prof, are you satisfied with the view that we are actually seeing signs of hope? We are seeing a moderate spread of the virus with relatively high health system readiness.
Yes, no, I certainly believe we are there, but there's no room for complacency. We can very easily have a second spike, and then this just keeps us in this lockdown situation for even longer. So certainly in the US, for example, they're talking about you either open up the bars or you open up the schools. Well, we're doing both here, so it's a real concern. No one's really concerned about sort of moderate alcohol, but we have a huge problem in South Africa with heavy drinking, and that's the situation that's likely to increase both the spread of the virus and the pressure on the trauma units. And certainly, I'm very worried that from Tuesday we're going to see an even bigger demand for trauma hospital space, because not only have we're relying on off consumption sales, but now we're relying on consumption sales as well at the time that people are dying to connect with their friends and relatives again. So I think there's a huge concern that we'll see a second spike driven, unfortunately, by the opening up of alcohol sales for on-consumption use.
But that's got more to do, Prof, with human behavior, and how do we alter that in such a short space of time?
Certainly, I mean, there's no easy answers. Certainly, I think perhaps starting with restaurants and allowing them to serve alcohol with a meal, that might be a starting point. But what we've done is we've just opened everything up. But as I said, there might be some more directives coming tomorrow, which might give some more reason for hope that the government is concerned about limiting the abuse of alcohol.